You have been diagnosed with type 2 diabetes and you do a Google search or maybe a YouTube search, seeing what supplements can help improve type 2 diabetes. And the result, you get a laundry list of supplements, some claiming improvement, some claiming that you can even reverse type 2 diabetes. Mind-boggling, right? The challenge is to, really ascertain what is good information and what is not so good information. Hi, I'm Dr. Soham Patel, a board certified endocrinologist and lifestyle medicine physician, and your host in this video series on type 2 diabetes. If you haven't watched my previous videos in this series, please watch them. I put the links in the description below. This is the last video in this 12-week video series, 12 video series on type 2 diabetes. So before we go into the video, I want to reiterate the disclaimer that any information shared in this video, as well as any of the other videos, is purely for education only, and you cannot constitute or use this information as professional medical advice. Always consult with your physician or healthcare provider when you're making any changes. So on to the question about supplements and type 2 diabetes. Now I'll say this firstly, that we do not need a laundry list of supplements to improve or help type 2 diabetes. Having said that, I would think of the supplements in three categories or buckets. So bucket number one are supplements which have a very strong body of evidence in terms of helping improve type 2 diabetes and overall health. Bucket number two are supplements which have benefit in terms of lowering sugars, but again, by themselves cannot undo type 2 diabetes. So they have benefit, but you have to look at that in along with nutrition. And then bucket number three is anything that I don't cover in bucket number one or two. I would suggest to not waste time and resources on all the supplements that people are claiming that it can reverse type 2 diabetes, because they don't. So starting off with bucket number one, in that the first vitamin or supplement would be vitamin D. D as in Danny, D. It is very important. It is almost like a hormone. Every tissue in the body has vitamin D receptors. And we know so much about vitamin D, but we don't know so much still about vitamin D. So it's still an ever-expanding field. But what we do know is vitamin D is an important part of insulin signaling. In other words, having good levels of vitamin D allows your insulin to process like it normally should, which leads to better sugars. And secondly, vitamin D above 50 on the blood level can actually reduce your food and hunger cravings. So, if you have hunger cravings, you're going to eat all the crap that you don't need, which is going to be high calorie and nutrient sparse, and leads to worsening your diabetes. So keeping your vitamin D up will actually help you keep the cravings down. Now, vitamin D is always should be taken with vitamin K2. Why? Because vitamin K2 improves the absorption of vitamin D. Number two, vitamin D by itself, taken as a supplement on a long-term basis, can actually promote more calcium buildup in the artery lining and in the kidneys, which we don't want, causing kidney stones. So combining the K2 with the D3 allows you to have better absorption of vitamin D. Number two, allows you to not have those plaque buildups and kidney stones. And ultimately, it pushes that calcium into the bones where we need it. So it strengthens the bone, it's good for the heart, and it improves absorption. So vitamin D3 with K2, that combination is important. The caveat is if you are on Coumadin or warfarin, which is a blood thinner, which actually vitamin K can interfere with that effect of that medication, you should consult with your physician or healthcare provider. Make sure they're okay or you have a plan before you consider starting that. So that's number one in the essentials supplement bucket. Vitamin number 2 is B12. It's a B vitamin, but it's very important for good brain function, for a good nervous system, for our nerves, for our heart, for good immune system, and overall energy. And more importantly, when you are type 2 diabetic, most likely you will be on metformin, or you may have been on metformin in the past, and metformin can affect the absorption of B12. So it is important to take B12 supplement in the methyl form of B12 under the tongue, so you get better absorption. So that pretty much completes the bucket 1, which is highly suggested. So vitamin D3 with K2 and B12. Bucket number 2, like I said, has benefits but cannot be looked at by itself to completely undo the type 2 diabetes effects, but they have still significant effects nonetheless. So the first one in that would be amla. Amla, or Indian gooseberries, it's a type of yellow colored fruit that's found in Indian subcontinent. It's very high in antioxidants and vitamin C. It's actually in the top 5 foods, if you grade them based on their antioxidant levels. In the top 5 you'll find amla, and because of its antioxidant effect, it is very beneficial to lower your sugars, improve your cholesterol numbers, so that has a benefit. The second is turmeric. It's the yellow spice. It's a root, but traditionally in India it's consumed by sun drying it and turning it into a powder, which is a spice. And turmeric has 100 plus active ingredients and things that can help lower inflammation. It's anti-cancer. It helps lower your sugars. It lowers any joint pains. It's good for the brain. It's good for the heart. So it has tremendous benefits for the whole body. Third would be cinnamon. It's a spice again, but cinnamon has shown to lower glucose levels. Now there are a few different types of cinnamon from where they are sourced from, and the one that is found from Sri Lanka, or Ceylonese cinnamon, has the most potency in the different types of cinnamon subspecies that we know of. Further would be chromium. Chromium is a mineral. Again, it plays a role in different reactions that happen inside the cells when they process glucose. So chromium has a benefit as a coenzyme in helping those reactions. Again, not by itself, but with the right food, which is predominantly fiber and nutrient dense whole plant foods. All these supplements that I'm talking about in bucket number 2 will add more value. Lastly, in the same bucket would be berberine. So berberine again works on an enzyme system that is involved in oxidation of the glucose. So plays a role in lowering your blood sugar levels. So amla, chromium, cinnamon, turmeric, berberine, these all play a supportive role, and you can consider adding them as a supplement along with the right food and good sleep and activity. But don't rely on them as the be all end all, because that's not going to work out. Bucket number 3, as we had talked before, anything that doesn't fall in bucket 1 or bucket 2 is essentially bucket 3. So save your precious resources and time, and not waste it on that. Anything that claims outside what I've discussed, will be less and less value in adding to your health and improving type 2 diabetes. So this is the last video in this 12 video type 2 diabetes series. I'm hopeful that the experience that I've shared in these videos on type 2 diabetes has been beneficial to you. If you like it, please like the video, share it widely, and subscribe to the channel. I will be making videos in the coming weeks on different topics, so please stay tuned. But till then, work on your health, and step by step, good food, good sleep, activity, good mindset, and the benefit of the vitamins and minerals that can augment to this vitamin D with K2, B12, and then some of the bucket 2 vitamins and minerals. So stay healthy and see you in the next video.